All right, so hello you all. My name is Tashana Johnson. I use she, her pronouns, and I'm part of the Whole You team. The Whole You is the well-being and engagement program for UW faculty and staff. Really honored to be here today and in space with you all and share this workshop. As we go, just a few things to keep in mind, please. As we go, participate to the degree that feels comfortable for you all. That could mean, turning off your camera or turning on your camera, depending on your needs. Feel free to use the chat box or the reaction icons that are at the bottom of the Zoom. And you're also welcome to send me a direct question or comment as you go. Please keep personal stories or notes shared confidential. So like what's said here stays here, what's learned here in terms of practices or terminology leaves here, right? And most importantly, just take care of yourself. If you need to pause, step away, stretch, have a bio break, or just leave the call, we'll be here, it's okay. And as I mentioned, this webinar is being recorded and it'll be shared at a later point. So as we go, please share what feels okay for you. Interact as you're able to. This helps build connection and helps us know that we're not speaking into a void. With that, I'm going to turn it over and introduce Dr. Jane Simoni to lead today's webinar on coping with trauma and transition. Jane is a professor and director of clinical training in the Department of Psychology, where she has been for 22 years. She's also a licensed clinical psychologist. Thank you so much, Jane, for being here today. Folks, again, I'll be in the chat and I will see you soon. Thank you.
Thank you. Welcome, everybody. I wish I were in person with you and could see you all. We were all in a room together, but that's really one of the reasons we need to talk like this, right? That things have changed so much and things are so different. So today, just as an overview, I'm going to provide a context for COVID and for why a lot of us are not feeling so great. Talk about some little bit of the data on the mental health impacts of COVID and the pandemic. Delineate the specific stressors of the COVID pandemic, just to see them, talk about them is actually helpful. And at this point, we'll have a brief poll. Shauna's gonna run that so people can reflect on what's been said and give some feedback about that. Then I'll continue on, talk about how, after talking about trauma, the fundamentals of good mental health. What are some things we can do about this right away that will make us feel better and help us to cope with things? And at that point, I think after that, there's another short little online poll about how people think about these, what they're using. And then I'll open it up to questions. And I have maybe about a half an hour of content. And then we have at least 10, 15 minutes for questions. And then there should be time at the end for a breakout room, people who want to stay. I imagine this is like when you're walking out of the auditorium and you're having these elbow-to-elbow conversations with people. It just gives you another, if people want to stay for 10 minutes or so and chat about what they learned and how people are doing, we want to provide that opportunity for anyone who's interested. Okay, Tashana, anything else I should say before I go on? Are we all set?
That covered it. Thanks, Jane.
Okay, all right, good. All right, let's talk about some of the background for this. So we know very well, those of us in Western Washington, that the first COVID case was diagnosed domestically here in January of 2020. And I know it happened to be someone that our family knew personally, the doctor who made the diagnosis. So it felt even closer to home. And I had just come back. I do a little work in China, just come back from a trip to China. So I remember that time thinking, geez, have I already been exposed? Times very didn't know what was going to be ahead. And since then, imagined in the short time, there have been 88 million more cases from that single one, almost 5 million hospitalizations, and tragically over 1 million deaths. Remember Deborah Burke saying, worst case scenario, 140 to 200,000 deaths. Well, that ended up not being true, right? So over the last 2.5 years, Americans have faced fear of infection, the illness, and the death. And you can see, I like to show this picture because it really just shows the rising, sorry, I'm going to go back. It shows the rising tides of this. And I can remember myself where I am on each of these time points on this timeline, how it was going up. When was it going to stop? With Fauci saying it doesn't necessarily have to stop at 100K, and it can go more and more each day. And then just when we were coming down, we were relieved it was over, and then we rise again, which each new wave, each new variant. So if it has felt like life has been uncertain and there have been ups and downs, this chart to me just really validates that, yeah, it really has been that way. And in terms of some of the numbers, qualitatively, Dr. Hubler said, right now, we're really anxious. A lot of us are distrustful, and it's affecting us in profound ways across our entire existence, not just with the pandemic. And in terms of the quantitative data, the World Health Organization estimates a 25% worldwide increase in depression and anxiety. And the estimates of adult distress in the United States are about 42% of us are experiencing clinical anxiety and 38% depression, some kind of depressive symptomatology. So that's a solid 1 out of 3 of us. The risk factors: Latinx identity, younger age, lower income, employment as or living with a healthcare worker, a first responder, and then if you're a caregiver. A meta-analysis, a review of multiple studies found, we looked at child and adolescent health, that depression and anxiety has doubled since pre-pandemic. And we were in not great shape before the epidemic, we have to say. So now to 25 and 20% respectively, we have some of our students, former students at the Seattle.
Your food is down there. Here's some fries. I need you to do
really
the dishes.
Have difficulty. Tashana, you might have to mute.
Okay, well, I don't.
And so in young people, especially, I want to say at heightened risk, we have some folks working in Seattle Children's. I've just said people are sleeping, in the hallways in the ER because there's just not a place to put them, and they haven't seen anything like this. So I hope that validates in some way, quantitatively what's really happening, and that people aren't alone if they're having a difficult time. And what are these specific stressors? Not just fear of the infection. Am I going to get sick? Am I going to be ill, even die? It's either myself or someone I know, but just experiencing having COVID and the fear and unknown nature of a long-term COVID. And then grief from bereavement and loss, and not just through death, but from all the things that we were supposed to have and we didn't. I happen to have a child who went through our senior year in high school during this time, and can imagine it was a very different senior year than we set out to think it was going to be, with proms and graduations and in-person events and trips. It was just a very different experience than others. And, in the early preschool years, critical steps in development. I think there'll be a long reckoning with all the loss that people experienced and how it's impacted it, especially people at critical junctures and developmental phases of their life. The social isolation and loneliness. I think about the kids going off to college, a time to be with other people their own age, being around thousands of other kids. Yet the schools invited them back, and some of them said, stay in your dorm room by yourself for 2 weeks straight and don't come out unless to go to the bathroom. So that's what we do in incarcerated populations as punishment, as behavior control, complete isolation. And even when we did get out, things weren't quite the same. There weren't the same groups. There weren't the same opportunities for interaction. Those of you on campus know it's been like that for 2.5 years now. It just doesn't feel the same in terms of the people that you run into. There's just a lot of empty offices, a lot of empty space in many ways. The school closures, as I alluded to, are very disruptive. Washington State was one of the most closed down in the country, honestly. And we'll look back and see whether those are really based on, scientific evidence or how those policies were decided. But mental health of the students wasn't always in the first priority in doing these. There were changes in work, upheaval in our daily routines. There was financial stress that's overlapped, and not coincidentally, with this inflation that we're having now. There was disruption in mental health care services and medical services, and voluntary operations, voluntary service, prevention services were all put on hiatus. And then all of this during COVID was in this context of what would have been a very difficult time in the world anyway, with global conflicts, racial violence, murder of unarmed African Americans at the hands of the police, climate change, political divisions, economic recessions, and now inflation, as I said. So in the context of that, it's a wonder that we saw those data on mental health. And if you look at I think of us in jobs and schools around the university or as students. And this one study that looked at healthcare workers, I think really mirrors the experience of us in other situations, that we're just feeling stretched out and stretched too thin. We look at all we're supposed to do, the percentage time of this and that, and it adds up to more than 100. So most are experiencing distress, anxiety, frustration, exhaustion and burnout, and just being overwhelmed in a lot of our roles. We're being asked to take on so much more with all the staff turnover and disruption. We're worried about exposing our loved ones, even if you're not a healthcare worker. If you go to school, I've had faculty say, I don't want to come to a meeting because I have kids at home who aren't vaccinated, and I'm a caregiver for an elderly parent. So there's stress about that, worrying about exposing others. And it's just emotional and physical exhaustion, with 82% reporting that. And it shows in terms of trouble sleeping, physical exhaustion, just even work-related dread, not even going to jobs that we used to like before. And physical symptoms, it has an effect on your body, like headaches and stomach aches. And then just not getting enough emotional support, whether at work or outside, just not getting the support that's needed to go on. And before I go on, I want to mention disparities. I touched on these a little bit before, but certainly communities of color, poor, socioeconomically disadvantaged individuals, those in rural communities, away from really high quality medical care, have really been disproportionately impacted by the epidemic. This is based largely on the legacy of medical mistrust in many communities due to racism and structural inequities and inequalities that a mass pandemic like COVID-19 really lays bare and really shows the cracks in a lot of our care has been. So there have been vast disparities in how people have been experiencing this epidemic. Just to say something about trauma that can be defined in different ways, but a deeply distressing, a disturbing experience. And it can be manifested in different ways: acute from a single incident that can be life-altering. It can be chronic, such as repeated and prolonged exposure and partner violence. And it can be complex, so exposure to varied, multiple traumatic events, often of an invasive and interpersonal nature. And examples are historical personal experiences of abuse or assault, grief and loss, financial, food or housing insecurity, and I would argue even navigating the pandemic. There's a sort of PTSD, post-traumatic stress disorder, I think, that people have experienced just from being in the epidemic. I know personally some medical care providers that have actually left the profession, that having worked especially early in the epidemic was felt like a wartime experience to them, and they have not continued in their jobs because of that. And then what are the signs of distress that you can see at work of students, staff, faculty? There's, besides the stress and distress, burnout, anxiety, sadness that shows up at different times and in the workplace, just trouble concentrating or prioritizing. I see this in my own work as a professor. I can do the emails, I can do the short things, but when it comes to some of the longer, bigger projects, it's harder to concentrate, it's harder to multitask. It's harder to have an extended period where we can focus on something and get something done. And I have felt that. And that this leads to a lack of motivation and really just procrastinating with things, trying to get up the energy and the drive that we used to have to do things. It also can surface as doubting the meaning and impact of our work. I see this especially with the students, the younger people. What's the point of this? Look at the impacts of the climate. Look what we're doing. It kind of has sucked the energy and the drive out of what I wanted to do in my career, because I'm not so sure about what the future will hold, if I can even get a job in this economy. And then loss of pleasure in doing what we once enjoyed doing. It's just the things we like just don't seem as fun anymore. We might see greater absenteeism, people just absent without leave, not showing up when they're supposed to be. You've heard the terms, quiet quitting, where you're still getting a paycheck, but really just doing the minimal work that you have to do. On top of this great resignation, people just switching jobs, realizing what they were doing for years is just not meaningful anymore, not worth it. And then also just feeling numb. So people might not say, I feel terrible, I'm distressed, I'm down, I'm in pain, but just numb, like not being able to feel at all anymore. And that's another sign of distress. So this is one time we were going to stop and just have a little poll. I don't know if Deshauna, if you can do that, if you'd like me. Okay. So moving along, this is a time to just have an important reminder. It looks like a lot of people are having some symptoms of this kind of distress, but when do you really know it's really crossed the line? And really, even if you see it in yourself or someone else, should you really reach out? If you are unable to function in your roles at home or work, so you're not able to get up in the morning, you have to shower to get out of the house, get to work, you're not able to take care of your kids or family members, you have seen drastic changes in your sleep. I don't know anybody sleeping great these days, but if you're really not able to sleep and significant 20% increase, say, in your weight, or substance use is really starting to feel out of control, or certainly if you have thoughts or any intentions or plans of hurting yourself, you need to reach out and seek professional help. And if you know someone else in this situation, you need to help them reach out as well. There's stigma around mental health problems and getting help. But if we face these head on and just are very direct about it and seeking help, we'll be much better off in the long run. And this applies to people, just asking directly. Sounds like you're having a hard time. Are you thinking of hurting yourself? This may be a good time to reach out, talk to someone else. A lot of people are doing it now, and it could be very helpful to you. So just matter of fact, direct communication about these issues. And on campus, we have a couple of options: crisis connection line, crisis text line, and now we have 988, the number that we can call to get help. But please do reach out and don't suffer alone when there are people who can help. Okay. So that was the first part of the talk, the stressors, but what can we do about this now? What are some immediate ways that we can start to feel a little bit better? And before I go into these, I want to make a distinction between some of these individual strategies I'm going to talk about and really wider structural change that might be needed as well, especially when I talked about the disparities. There need to be changes in society so that whole groups or whole populations, subpopulations aren't feeling worse or doing worse than others. Those larger structural changes might happen at the U as well. Maybe our unions need to talk about more availability of mental health services or more flexible time off. So those are structural changes that are needed and would help. What I'm going to focus on is more immediate individual kind of actions that you can do right now. So it's not to say these are better or more important, not at all. I think we need them both, but this is something that may be helpful and hopefully will be within your own control right now. So, and the fundamentals of good health, I'm just going to go through a list of some of them. And the first is some of what we're starting to do already, which is to recognize, to label, and to validate your emotional response. Just acknowledge how we're feeling right now. And it helps to really give names to it. Are you overwhelmed? Is that it with all that's going on? Because that will help you think about, maybe I need to cut down a bit. Or is that you're sad or depressed? Are you disappointed in something? Are you grieving a loss? And if so, what is it that you're grieving? Do you feel hopeless and that's what's sapping your energy? Are there things that you could focus on in which you would be able to achieve something? Are you just anxious, generally anxious about what's happening? Or is there something specific you're anxious about? Is it being infected or someone dying? There are different strategies you can use based on how we're feeling. And is it just fear, general sense of fear? Are you disappointed? Are you frustrated and disappointed over the seemingly endless cycles of the pandemic? Is that what it's really about? Or did this start a little sooner? Or is the one specific event that happened? Are you tired of constant crisis management at work? I know there was a New York Times article where they talked about this feeling of languishing, and that really touched a chord in a lot of people. Just languishing, you're moving along, but things don't seem as fun anymore. Things don't seem as engaging anymore. So all these emotions are understandable. You're not alone in any of them. They're acceptable. You should validate them. You don't have to pretend you don't feel this way. You don't have to feel bad at yourself for feeling this way. But the first step is just recognizing what these are, how you're feeling, and realizing you're not alone, and start to label them in some ways. Number two, one thing that sometimes helps, it seems like a small thing, but it can be helpful to get yourself out of a rut of focusing on some of the negative aspects of what's going on. And this is a strategy called 3 Good Things. You can see the link at the bottom. There's actually a great website for doing this. And it's a practice, a daily practice, in which you literally think about 3 good things that have happened the day before. And these should be very specific events and experiences. It can't be, at least I have a job, I'm alive, the world hasn't burned up yet. I mean, this is specific things that happened yesterday. Somebody asked me to lunch and I went. I had a good conversation with my child, and we've not been getting along recently. I mean, very specific things that you did. I went shopping and bought something that I really liked. I was able to have a coffee break at work and someone went with me. Think about these. And if you can, write them down. Explain why they went well, how they made you feel, and what caused them to go well. If you don't write it down, it's okay. Don't feel bad. The idea is to think about it and to dwell on something positive and to think about why it was helpful, because it primes yourself to do more of these things. And then try to come up with 3 different things each day and focus your attention on them rather than ruminating on all the things that bother you and all the things that aren't going well. It's just a way to shift your mind out of a pattern or a habit of thinking about things that aren't working. It's easy to get into a mental or cognitive rut. And so this is a way to try to go beyond that. And again, check out the website and try it. Don't be hard on yourself. You don't do it every day, or you don't always write it down, or you don't always think of 3. Just start to do it when you notice yourself going through some of the same kind of negative thoughts again, and see if that doesn't help a little bit. The third one is bodily care. In the West, we really make these arbitrary distinctions between your mental health and your physical health, when really your body, your mind, your soul, your psyche, they're all related, and they interact and are mutually influential. So first I would say is good sleep hygiene. Heard a lot about that lately, how it really impacts. We've often said depression is technically a symptom. Sleeplessness or sleep disruption is a symptom of depression, but also it can cause depression when you're not sleeping well, when you're tired. So getting the right amount of sleep, which is probably minimal 7 hours, maybe even up to 10 for teenagers, and going to bed and rising at the same time each day. So using your bed as a time you sleep, try not to read it, don't do your work in it, use it as a time for relaxation and sleep, and try to go to bed at the same time and get up. Even if you're on a roll with your work or some things, you're binging some show, try to stick to a little bit of a routine. And even on the weekends, if you end up staying up, 2, 3, 4 hours later than you usually do on the weekend, disrupts your sleep. It disrupts your caffeine intake if you're used to having coffee in the morning, and that can be disruptive to your whole day. And if you can have some kind of sleep regimen or routine, it can help you with the routine for the rest of the day. Having some kind of routine can be very helpful. And then nutrition. We're finding more and more your gut biome, the kinds of food you eat, how often you eat, how you eat, your BMI can have impacts on your mood. So nutrition can be very important. So stay hydrated and eat enough healthful foods each day. Look for patterns that aren't working and try to affect them, and get help from your primary care provider if you feel like your eating's getting out of control. The third, we're learning more and more about the connection to nature and how being embedded in nature and surrounded by nature, the outdoors, can have such a positive impact on your mood. So go outside, connect with nature, remind yourself there's more to life than a screen. And I know even my doctoral students sometimes will say, oh, I haven't even gone outside the apartment in 3 days. And I don't see how that's possible in Seattle when we have relatively mild winters and summers. Need to get outside every day. I, for one, have found my dog has been particularly good during the epidemic for this. I find myself getting into a rut in the mornings, just waking up, oh, it's Groundhog Day, the same thing again, I'm not going in. So I started to take the dog out for a walk even before breakfast. And just getting outside. So many parts of Seattle are beautiful. If you're lucky enough to live where you have a sidewalk or a place or even a park you can go to, I really recommend it. It can be short, even 15 minutes. And grab a neighbor if you can, or someone in your household to go with you, but really recommend that for getting outside. And then activity level, stay active. Movement boosts energy and mood. And notice, I'm not saying here, run a marathon, join an expensive gym and go every day. I'm saying move around, stand up at your stand-up desk if you have to. And that could be a counter. That's what mine is. Go outside for the walk you're going to do. Just walk around your living space. When you're on a conference call, my earbuds are the best purchase of last year, that I can just do things without having to hold a phone or a device, and I can just move around and be active. And if you can structure that in some way, I'm a member of an old ladies soccer team or a tennis club, a group. When you find people that are doing something, maybe it's a walking club. I do a hiking group on the weekends. Try to get people together in a pattern or a consistent way so that you don't have to plan it every week. Because again, that can be hard to do when we're not feeling so great. So sleep, nutrition, nature, activity, 4 really important parts of bodily care that can have direct impacts on your mood. And you can start doing those today. I want to say something about substance use, because I didn't mention the data on it early on when we talked about depression and anxiety, but there have been huge increases in substance use during the epidemic, alcohol and other drug use. People start consuming earlier in the day and more often. They don't have the structure of work or going out. In Zoom calls, it's easy to hide an addiction. So relying on substances can really interfere with learning to cope successfully with the stress. It feels better sometimes in the moment because you kind of mask it, you avoid it. But in the long run, it does not contribute to overall better mental health. So monitor what you're doing. If you need to, really take a look at it, cut back, and seek help if you find you can't do that on your own. And then connecting with others. I think I've said this a lot during the talk, that frequent interpersonal connection and good social relationships are critical to both physical and mental health. And there are more and more data on this. Connecting with other people in person is best. People like social media, it's easy, it's convenient. It's just simply not the same. And studies have shown it as face-to-face, even on the telephone. People forget that the iPhone can be used as a phone as well. It's just a different way of communicating. And it's just more compelling. And it's what's made Zoom education so different. Share with people, try to talk about how you're doing, encourage others to do the same. Reach out, support others. We know that providing support and care and being helpful to others is a way to feel better yourself. So if you can engage in these mutually beneficial sharing relationships, it's very, very important to mental health. And I know these are hard to do now. I know like lockdowns and people are afraid to go out, but there are ways that this can be done safely. I don't think being outdoors was ever a threat, vulnerability for getting COVID. So I think if you can do things outdoors, you're pretty safe. And there are ways that people can connect in ways like this. Stay on the call the last 10 minutes. You might be a little shy or anxious about doing it, but I find even short conversations, the ones we used to have at work, in the hallway all the time, they can or you're out in the yard and you go for a walk, you talk with a neighbor 5 minutes. They're the kind of things, the social glue that sustains us and that helps us go through times like this. So really encourage you connecting with others. I want to say something about this trauma and stress that we're feeling, how it can disrupt these mental health practices. The things I said you can start them today. It doesn't mean it's easy to do them all the time and to really make them habits. And when you're feeling anxiety and sadness from trauma, which can, for example, heighten your social anxiety, you're less likely to want to call someone. You're more likely to feel acutely a sting of a rejection. A person can't do something with you. And sleep may be disrupted by recurring distressing thoughts that are the hallmarks of an activated central nervous system. An autonomic nervous system response to trauma, this fight or flight response that makes it harder. So how can you have a sleep routine when you're waking up at 2 o'clock in the morning and you can't get back to sleep? It does make it harder to do. One way to counter this is, I didn't add this, there are many other things I could have said for good mental health, but one is really having a practice, a relaxation or meditation practice that can counter this response to trauma. People do it with mindfulness exercises. They can be short. You know, I do with meals now. Try to have your meals, don't multitask. I go outside if I can, even if it's short at work. I find a place that's outside. I don't have my phone on, and just have a mindful meal. Try to find someone to do it with you if you can. Yoga, there's yoga classes being offered all over the university in different places. They're free online. That's a good way to do it. And just your own meditation practice, that can be helpful as a way to counter a lot of this disruptive trauma. And like I said, there are other ways. I mentioned having a routine, finding purpose in life, having a spirituality, having a religious practice, a religious community has been very important in people with mental health lately. So there's the other things I didn't even mention, but I hope at this point, I think we're going to have another little poll before I open up to questions, and then we'll have a chance to share. But Shonda, do you want to?
All right, so one question that has come up would be, can you or others discuss a bit more or provide background around obstacles that LGBTQ people and BIPOC can experience with those that are supposed to, you know, we're trying to be here to help, and or finding a facility or mental health professional who understands LGBTQ and BIPOC or intersectional issues. So really some of the barriers that folks might be experiencing, some of the hurdles in getting connection to supports, and any tips or strategies. I hope I phrased that correctly. Please do send me another or send me clarifying if there's anything else to add there.
It's a very important question. And I just touched upon it briefly in talking about disparities, but it's certainly true during this epidemic. I know I'm in an American Indian family myself, an LGBT American Indian family, and I've seen some of these things up front in terms of that devastation of COVID on the Native community. I think a lot of it stems, as I was saying, from these structural factors that were here before the epidemic. So when there wasn't good health care, there was financial constraints, when there was demonstrated structural discrimination and racism in terms of everyday functioning. And then with the epidemic on top, it just exacerbated those outcomes. And I think it's fortunately affected our mental health profession as well, so that people for diverse backgrounds do not always feel equally comfortable seeking out mental health services. Their providers don't yet reflect the diversity of those who are in need. So it's difficult to find someone. It's often more relatable to find someone who looks like you when you go for help, and we don't always have people available. But I would call those numbers and talk to people there. There's also a training clinic at the psychology department as well that can give referrals, and that can sometimes has available some low cost care. But those, and just some of the stressors in the epidemic have been, I mean, with Black Lives Matter, with the anti-Asian violence, has been, actually explicitly targeted some people of color. So I think there's just so many different factors, even before the epidemic, that made it even harder to survive. But I hope you can look out for ways that, and find people who can help and can be, that you can relate to assist you with adapting.
Wonderful. I'm going to check. Thank you so much for that answer. I'm going to check. I'm not seeing any other questions within the chat box, but I will gladly stop the recording if we want to move into folks asking questions, either via chat, or if it feels comfortable, you can also come off of mute. And Jane, I'll invite you to stop sharing your screen. Oh, just kidding. Never mind, you're not sharing your screen anymore. Cool, we'll edit that out the recording. I'm gonna pause here, stop the recording, and open up the Q&A part.
And I think everybody can see the chat. There's some great examples of what people are doing.